I am here with Rik Heller from Wello. Rik, you are the CEO and founder. Could you please tell us a little bit about yourself and what Wello does?
Pleasure. Uh, as you heard, I'm Rik Heller, and Wello, our company, looks at disease spread and the dynamics of disease spread, and it does that with our mission to make wellness epidemic. So we have one side that builds a model for what these kinds of diseases can do when they turn up and when they turn down. And that is something that we've patented, and we even make an app available called Wello Watch, which is one word, Wello Watch, and you can get it on iPhone and you can get it on Android. Therein, you will see on an hourly basis an update as to what the moisture level will be inside your building. And I know that sounds like, how could they do that?
Huh,
Well, well,
interesting.
it turns out, or you may live 10, 15 miles from your office, and it turns out your living room is the same effective humidity as your office. Your office may be a little bit more in tune with the outside because buildings by their very, by law, have to constantly recycle air. And by doing that, the moisture from the outside is the moisture inside.
Got it.
And the reason, so that is, okay, so the reason that that's interesting is, and confusing, is because relative humidity keeps coming up when we're about to go out and play or do something outside. And we say it's a humid day or it's not a humid day. And it gets very confusing as it gets cool or dry, particularly in California where you have beautiful days. It could be moist, could be dry, but they're beautiful days all the same. Well, it's the dry days that get what's called entrained, which means the moisture comes in. And those are the days that two things occur. One is that if a sick person comes to work, they will spread more likely, and we're talking about 10 to 100 times more likely to spread than on a moist day.
Really
And
interesting.
And so you get this thing called dew point, and nobody knows what to do with dew point unless you like to run or play tennis, and everybody knows, to try to get a dew point under 60 degrees and you'll have a great game. It doesn't make a lot of sense because it's a temperature, not a moisture level, but it turns out that it's a moisture level. So then the other thing that happens is when you go to sleep at night, and we're even 50 miles or 100 miles from work, we're really at the same moisture level. And if it's dry, our lungs dehydrate. And the lungs are not part of our internal organs, believe it or not. They're actually more like skin. And by dehydrating, they are more susceptible to a bug. It could be bacterial, it could be viral. So there's a lot of things going on in your lungs. They're very clean spaces, unless they get infected. And the only thing that's in there are these things called macrophages, which we can nerd out on. They're part of our immune system, and we didn't even realize that. It's funny, medicine for a long time, and only more recently, that we actually have things policing the skin, basically, or the inside of our lungs. So what we do is we take temperatures of people because temperature is the leading indicator of contagiousness, and that contagiousness is very important today with nCoV-19, what it is. And it's also very important. I get a little bit of criticism for mentioning flu, and we talk about nCoV, but flu is very bad. This is a terrible season for flu. The death tolls are in 20, 30,000 rate in the US, and it changes daily. And so flu is behaving very similarly to nCoV,
Yeah.
except for the fact that nCoV is new. So it sort of went up, and it's sort of leveling now, just like flu is.
So what I'm hearing from you, Rik, is that definitely everyone needs to hydrate. and you're more likely to spread germs on dry days. And the other part of this is that people need to understand is that there is a separate strain of flu going around that is actually kind of affecting more people than the coronavirus or COVID-19. And what are the Wello device that you have is actually it's in Asia. You're in a lot of different facilities. People are actually using these devices to see if they are sick or not. Can you tell us a little bit about what you are seeing overseas, and should people be worried as we are? I know a lot of daycares are thinking about shutting down. A lot of parents in our areas, they've got work from home, and there's a lot of insecurity and there's a lot of clamor. So what is actually happening out
Well, so as far as daycares are concerned, of course, it's a very big topic. So, we know about the European outbreak, particularly in Italy, that's shutting down. I can't tell you what Germany is deciding, but they're going to err on the side of caution almost always. We have Vietnam in Asia that is very much erring on the side of caution. Everybody wants these devices, particularly for the military for some reason. I guess they must have a lot of funding, but they want to make sure that they can separate out sick from well people so that, because the military obviously works in groups and they don't want sick soldiers. Then we move up to Japan, and they, along with Korea, are feeling the uptick in this and have not, that I know of, began quarantine measures, but they began the kinds of things that we're doing here in the United States, social distancing. And they have always, Japan in particular, has always been people who wear masks. You can buy them at their quick stop stores and bulk. And they wear masks for different reasons than what we're seeing Americans. Americans seem to wear them to stay well. And as you've heard from the CDC and other authorities, they don't work. You're not going to be well if you wear a mask. You're not going to stay well.
Right.
However, if you're sick, on the other hand, you're going to cut down the ability to spread significantly. So we want to save those masks for sick people. And the first thing you do when you come into a hospital, if you say, I have a contagious disease, or they detect it, even symptoms, is they put a mask on you first and foremost.
Not everyone else. And so, there's, I'm not going to lie, I actually picked up like 10 packs of masks because I was up in an area 3 hours from here and found a bunch. And again, it was just kind of a little bit more panic. But what you're saying is that if you are going out and buying masks, it's not necessarily going to keep you protected from the virus, because it does spread through, coughing and contact, correct?
Yeah, the virus, particularly the small droplets, are the worst. They're 2 microns, and the masks do not protect you from, they just don't have that fine a mask. You probably couldn't breathe if they had one.
Got it. And now, are you seeing childcare facilities shut down overseas? And if so, what is the impact of that?
Unfortunately, I can't tell you much about the current news with childcare. We keep hearing that what happens is when they shut down childcare, one of the biggest problems that we heard, particularly in Europe, was that in Japan, was that much of their healthcare are staffed by people who have children. So
Wow.
they
Okay.
they make them take care of the children, and they're going to have to stay home from work.
Right. That's so true. I know in my, I actually have my own daycare as well. And one of our biggest concerns is that if we shut down, the children will actually be taken care of by grandparents, which is probably a riskier age group. So I know I heard in Italy that schools and daycare shut down, and that had a major impact because children were gone to stay with grandparents. And so it's, children are, just to clarify, children are not as susceptible to this virus as adults and elderly are, correct?
Correct.
However, please go ahead.
Well, real quick, there's 2 issues here. One is susceptibility, and the other is symptoms. so that they don't exhibit much in the way of symptoms, which is obviously a good thing because then they're not, going to wind up in the hospital or on respirators or things like that. And then it is thought also that they are less susceptible, so that one with no symptoms would not necessarily test positive. So that there'll be these answers coming in the year ahead. But the good news is that children, while susceptible to certain flu and are taking some lives unexpectedly, they're not that way with nCoV-19.
Yeah, got it. So, for the most part, if a daycare is shutting down, it's probably the result of the own staff members not feeling well. But I think kind of what I'm hearing is that we should at least attempt to keep our doors open and hydrate and take care of ourselves and follow proper measures from the CDC.
Exactly.
Got it. Please go ahead.
There's one other thing though that has come up. My children, we're empty nesters, and so I don't worry as much. But now I have grandchildren, and it does come up from time to time, and that's these over-the-counter medicines that we want to dose our kids with properly, and yet there's something that you need to know from particularly the AMA. The AMA tells doctors that they're not to prescribe. They kind of give the rules for prescription of things like acetaminophen, which we see branded as Tylenol and other things, and they'll put in these elixirs or cough syrups and things like that. They'll put these different things in there, in particular acetaminophen. And so when it comes to aspirin, ibuprofen, Aleve, whose name I forget, the generic, these are not therapeutic. These are they're actually for comfort only, according to the AMA. So it kind of means that
so kind of like children's Tylenol is if we're talking about, because that is one thing that we frequently would use in childcare. And that's actually a great next question, which is that if you do have a child with the flu or symptoms of it, I guess what you're saying, aside from seeking medical treatment, these drugs are not maybe the right course.
They're not the right course. Now I can't speak to their health. I can tell you from a spread point of view, the studies that I've seen, in particular the Ministry of Health in Canada, they've shown that communities that use these more will spread this more. And here is what's happening. You're going to actually reduce your fever, potentially, not that much, but you're going to have a lower fever, but you're going to feel better. Yeah. And when you feel better, you're not sick. And so if you think you're not sick, you're not going to be in bed and you're going to get out.
Go out and do things. And yep.
Exactly.
And one of the big things in our industry is, unfortunately, drug and drop, where a lot of parents, will just give kids Tylenol or something to get them to childcare if they're not running a very high fever, and then the medicine wears off at the end of the day. So we tend to say they have to be at least 24-hour medication free before they can return to daycare. Is that a general good rule of thumb?
Oh my goodness, it would be great. I mean, we can be so sympathetic to the parent who has a sick child, but the problem with that whole drug and drop, I haven't heard, and that's a great, great aphorism. So the problem with drug and drop is just that they're just as contagious at 101 when you drop them down to 99 degrees as they would be. They're just as contagious at 99 degrees in that case than they would be at 101, and that's highly contagious. So they may feel better, they may be more interested in eating and drinking. Well, that would be good for their health, but it's terrible for the people around them, the other kids and the other staff.
Got it. And so, Rik, if a family has a child that is showing symptoms, or if a family member is showing symptoms, what is the best course of action? Even if it's not corona related, what is the best course of action?
Well, we know from health class in high school even, we know that what happens when you have infection, and it could be contagious, it may not be contagious, that your heart rate goes up, your temperature goes up, If you have any cardiovascular problems, and that's one of the problems with elderly people, if they're weak in a cardiovascular way, a fever fights the wards off the infection by increasing heart rate, shutting off blood to the skin, vasorestricting it's called, and then vasodilating their organs. And that creates the heat in the body, which is a fever, which is good for you, supposedly fighting off the infection. So the most important thing, I think your question was, is what to do.
Yes,
Uh,
precisely.
so the key thing is to hydrate, because the one thing you don't want is a co-infection, and a co-infection will come if you go out in public, when you're sick, particularly if you're on antipyretics. There's an argument that says if you lower your temperature, you will actually be more susceptible to yet a second infection than if you leave your temperature alone. So if you feel miserable and you have a temperature, you might actually be warding off other things. Stay in bed, get rest, allow your body to heal itself, and certainly hydrate, because that is the way your immune system, it's almost like fuel for your immune system.
All right, Greg. One last question before I let you go. In terms of the coronavirus, do you think we are getting worse, or we are starting to plateau in this? There's definitely a lot of mass panic, as I mentioned, with daycares. This, we don't get a lot of leadership from the states in terms of what to do, having a plan of action. So just trying to get some good information. Are we seeing a decline, or is this still on the rise?
Well, we model this, and we have even calendars. And so we can look at the calendars in the past for our models this time last year. So let's start real quick with Wuhan. There was a big event in the middle of February that our model showed would cause further outbreak and increase. And we saw we predicted the increase would be late February, early March. We saw that hike. And since that time, middle February, we have not seen any of these large disturbances. We saw a lot of them. We saw 2 or 3 in January and 2 or 3 in December in Wuhan. Wuhan is sort of like Texas, Oklahoma. It's the middle of China, pretty centered and landlocked.
Mm-hmm.
So, they get a lot of weather from Siberia, they get it from South China, so they fluctuate a lot, much like our area here. I'm in Dallas, Texas. So I'm sorry, I forgot the original question.
Yes, I'm just asking if you're seeing an increase or decrease.
So the prognostic on this, from our model's point of view, is that it is leveled, and it will be on the decrease. And that's based on the fact that since the only model that we're using is a seasonal model, which is much like flu. So you're going to see flu, which again is very bad right now. You're going to see it level. It's already, in fact, and it's going to start coming down. And what will happen about April and May, and this is an opinion and maybe a hypothesis, that you'll see it coming down by May. You'll see it low in June and July. Now, while everybody is given, fist bumps and high fives for that happening, what we really have to guard against is what happens with these late falls and late winters. So what we saw in Wuhan, we'll see in California, we'll see in Texas, we'll see nice summer days. It'll be very moist. California, unfortunately, gets some dry periods.
Get some dry, yep.
And those are beautiful days too, which are just, surprising that we get beautiful days that are actually spreading. In Texas, they're mostly moist, so we'll have a little less of it and be a little bit more protected. So we still have to maintain these, what are becoming very good habits, by the way.
Yes, absolutely. Wash your hands.
Yeah.
I like the 6 feet of personal space. I really do.
Yeah. So what the thing to be concerned of most is how well we maintain the habits, how we stay away from these elixirs, try to live out infection, because that'll keep the spread down. It helps our neighbors out or anybody we're around, and keep everything from the measles to the flu to this insidious nCoV-19 down. And then if we can make it through and into next winter with a low number, we'll be fighting it again, possibly. It's just hard to say or believe that we're really going to shut it down like we shut down SARS. But we will be able to keep those numbers low. But that's the whole trick here. And while people think we're overreacting, I don't think they realize how bad this could actually be if we didn't do the things that we're doing right now and give China the credit due for their very large act and sacrifice to their economy of containing this thing, for even the world for that matter.
No. That's amazing. Yeah, you are so right. I guess, we all complain about what's happening and the extra precautions and things flying off the shelf, but these really aren't necessary precautions. And this is not something to be taken lightly. Everyone should be prepared, but doesn't, I think, like, as you said, watch out for the dry days, hydrate, take care of yourself. And we can at least keep our own personal doors open for now. So
Yeah.
that's great. And so, Rik, thank you so much for your time. If you could please let people know where they can get Wello Watch one more time.
So on our website, welloinc.com, that's WELLOINC.com, you'll find a pointer to it. It'll take you Apple Store, Android, whatever you want. And then you'll also see our Wello station. And what the Wello station is, as we've talked about, is it just prevents sick people from coming to work if they're febrile or fevered. And so we call it stop and check, don't infect.
That's
and
great.
You'll see these in more and more places, hospitals and offices and things like that.
Awesome. Thank you so much for your time, Rik. Really appreciate it.
My pleasure. Be well.
Take care. Bye-bye.